And maybe you are lucky enough to find one of those at-home COVID test kits. They're hard to find right now, but let's talk about how accurate they really are and how you should determine when to get tested.
At-home COVID tests can be purchased over the counter at drugstores and pharmacies. Public health officials are urging Americans to get tested before and after travel or a family gathering this holiday season. But how accurate are these tests?
At-home tests, the accuracy, first of all, depends a little bit on what we call prevalence, so how much virus is around. The more virus that's around, the more accurate these tests can be.
Dr. Trish Pearl is the chief of infectious disease at UT Southwestern and Parkland Health. The two types of COVID tests available right now are antigen and PCR. The PCR test is the gold standard, often used in clinical settings. It's also more accurate. Antigen tests are used for rapid tests and at-home testing.
In general, they are much more accurate if you're symptomatic than if you're not symptomatic.
So if you have no symptoms and you're trying to get together with family, Dr. Pearl says the best thing you can do is to test multiple times.
The test isn't perfect, so it may not tell you whether or not you're infected, but it should tell you if you're infectious. So if you do it right before you go to your event, and you have a negative test, you can feel relatively comfortable that you're not infectious. And then if you do it 2 days later or 3 days later, you can feel comfortable that you weren't incubating at the time, so you don't need to notify the people who you congregated with. Now, there's a different situation. You go to a party and you want to know whether or not you caught COVID at the party. So then what you want to do is you want to test yourself 36 to 48 hours. So then you would repeat that test again 2 to 3 days later. Now, obviously, if you develop symptoms in the interim, then you want to go in and get one of the PCR tests.
If you have had a known exposure to someone with COVID, it's best to test for the virus, then quarantine and repeat the test 4 to 5 days after the exposure. For safety, wear a mask and stay physically distanced.